All right, so look, thanks all for being here today. Want to thank all of the members of our city family that are behind us as well. And thanks to Barbara Garcia, our head of our Department of Public Health, as well as our San Francisco AIDS Foundation, who we're partnering with here today. Look, our needle and syringe issue in San Francisco has really become an epidemic on our streets. It is something that I've heard about for a long time before becoming the mayor, and now as the mayor of the city and county of San Francisco. It is one of the things I hear about the most. And people, quite frankly, are fed up with the conditions of our streets, and as am I. And so today, what we are announcing is that in partnership with the San Francisco AIDS Foundation, we are creating a dedicated team towards needle and syringe pickup here in the city of San Francisco. We're going to be staffing 10 individuals whose sole job and responsibility will be to pick up the needles and syringes here in our city. Again, it is important for me as mayor to make sure that we do everything possible and that we send a message to our residents and actually make a difference, by the way, on our streets, most importantly, that the status quo on our streets today is simply unacceptable, and we're not going to stand for it. And we're going to do everything we can to combat that. We have great leadership, and we have people that have been working on this issue in our city government, but it's not having the impact that we need today. So that's why we are creating this new initiative. And I will tell you, it is one of the things that, again, I hear about the most as the mayor of the city in San Francisco, and we are going to move forward with this program. So these individuals, this new team, will be doing two things. One, they will be proactive. They will be going to known hotspots where needles are known throughout the city and county of San Francisco, in different neighborhoods, different spots, again, that are very well known. We just did a needle pickup down here on Natoma Alley. Collected some needles in that box. They will be going proactively. But also, I think it is so important as mayor of the city that we are responsive to our residents. So now people, when they call 311, based upon the data we receive, we will have people that can immediately respond to those requests and those calls for needle pickup as well. Again, this is a huge issue for the city of San Francisco. As mayor, I fully acknowledge it, and I want to make sure that as a city, we are doing something proactively about it. So today, again, with the creation of this new team, San Francisco is taking a step in a new direction, and we are making sure that we prioritize this for the residents of our city. So with that, I would like to bring up Barbara Garcia, who's doing an amazing job of our Department of Public Health, to talk a little bit more about it, as well as we'll bring up the head of our San Francisco AIDS Foundation as well. Thanks, everyone.
Good morning. Thank you, Mayor Farrell.
Do you want to lower that? Yeah. Here?
The 6-footer and the 5-footer. Okay, better.
Aha.
Yeah, now we
Thank
can see
you. Barbara Garcia, the Director of Health. For the last 5 years, the department has attempted to begin to do a lot of pickup. We do a lot of needle pickup in terms of at our needle access sites, and we also have been doing street needle pickup. So we've expanded our team and we'll be expanding our team to 10 more individuals. We have a response team already that's on the streets every day. We also have over 30 individuals that work with us throughout the city with our CBOs, our community-based organizations. So this will be a group of 10 individuals that will be focused on needle litter. And they will be walking the streets of San Francisco to ensure that we have no needles in the streets. That's our goal. And we'll be doing this effort along with our environmental health department, which is here with us today, along with our many community-based organizations. We believe that this is a really important initiative for the community of San Francisco. And as the mayor gets complaints, I also get complaints. And I've been trying to respond to this, but it's really clear to me that we've added more kiosks, which are large disposal kiosks for people to drop them off in the street, but we also have to go find them. And many times they're under gates, they're in the streets, and so we're going to be doing every attempt that we have to be able to pick up as many needles as possible for the general public support and general public health, as well as the fact that we believe that this is an essential health service that we should be providing. I'd like to call up our director of the San Francisco AIDS Foundation, who's our partner in this project, and he will be providing the team for us, Joe Hollandona.
Good morning, everyone. I again want to thank Mayor Farrell as well as Director Garcia for their steadfast commitment to protecting and promoting the public's health, and this recent investment allowing us to expand our team by 10 additional people who will focus specifically on needle waste will be very impactful to the city and to making sure that our streets are clean and safe. Each year, the San Francisco AIDS Foundation with our partners collects unlimited number of syringe on our streets. In fact, every month, us and our partners at the city collect 275,000 syringes through multiple channels. That includes our harm reduction center, our kiosks, as well as street sweeps. And so we believe that this will allow us to expand those services even more and collect even more needles. And as the mayor said, we will be both proactive and reactive. And so we're very thankful to the mayor as well as Director Garcia for their continued investment in sound public health practice, and look forward to partnering with the entire city on this initiative.
We'll take questions now just on this initiative, and then we'll go to other questions after that.
That's correct. So 275,000 syringes are picked up each month by San Francisco AIDS Foundation, the city, as well as our partners. So each, between the three different strategies, so syringe access, disposal boxes, and sweeps, about 8,000 of those are picked up by sweeps, and we expect that number to go up significantly as a result of the 10 additional people.
8,000 out of 275,000.
That's correct. That's correct, through our sweeps.
Can we get an update on the safe injection sites? I know that that's something that Ms. Garcia has been championing, and I heard they were supposed to come in July.
Yes, we're still working on the legal issues. We're also working with the state on legislation that would really provide us a little bit more protection on that. And so I'm actively still working on that. We don't have a timeline as yet, but we have all the partners ready to go. We're just having to work out some of the issues, the legal issues that are inhibiting us to open these up right now.
But wouldn't that, if you were able to do them, wouldn't that affect the ability to
Absolutely.
limit the number of needles?
Absolutely. Worldwide, those safe injection sites show that they contribute a lot to reducing needle litter in their communities. So we do believe that will be on another initiative that will help this issue.
What are they shooting up? What are you finding? What are they using?
I didn't hear you.
What type of drugs are they using?
Well, in our what we know that people are using of illicit drugs. Methamphetamine is one of our biggest concerns. Next to that, and even more so, is fentanyl. And fentanyl is 100 times stronger than heroin. In fact, today as I was leaving the health department, we saw somebody overdose in the park. It's really important that we provide these individuals support, but we also see people are shooting up fentanyl, heroin, methamphetamines, cocaine are the biggest issues that we see from the hospital reports.
Barbara, when you get a secondary accident, someone stumbling over one of these needles, what's a typical scenario? A child picks it up, someone steps on it. What are you most concerned with?
The biggest concern would be somebody stepping on them, but we haven't seen any cases of an outcome of a needle prick. But we're trying to make sure it is just a terrible thing to see, and it's a very unsafe issue to see. So that's why we're really working on the environmental health factor of needle access.
Mayor Farrell, why is this a better plan than Supervisor Kim's street sweeping proposal?
Yeah, look, appreciate that Supervisor Kim made that request. I think twofold. First of all, you don't do budget supplementals in the middle of budget season. That's completely inappropriate. And second of all, her ask was specifically dedicated towards District 6 and the neighborhoods that she represents, which I appreciate. And these are some of the areas that are affected. But from my perspective, this is a citywide issue. I don't know a single district supervisor that has not gotten complaints about this and does not get complaints about this every single day. I did when I was representing District 2, and as mayor, I hear it from all across the city of San Francisco. So from my perspective, this needs to be a citywide approach, not target just a few neighborhoods. That's why we're moving forward across the city of San Francisco. It needs to affect, and residents of San Francisco need to know that this is going to impact their neighborhoods, no matter where they live. And I will say also this to the residents of our city, please use 311. We are beefing up this tool, both from a technology perspective, but also from a resource perspective to be able to respond effectively. Use 311, that is the way you're going to be most effectively able to respond and get those needles off the street as quick as possible.
So a woman who owns a business here called 311 overnight because there's human feces right outside of her door, but she says it's just as big of a problem as the needle.
Yep. So look, street cleaning as a whole, needle pickup is a part of it. A huge part of it, very visible, something we can wrap our arms around. But in terms of feces and urination, also a huge issue. Later on this week, we're going to be talking about the street cleaning initiatives, the broader ones that I'm going to be unveiling in this year's budget, and I promise you that will be addressed.
Sorry, so just kind of piggyback off of that question.
Yeah.
You talked about why Mayor Farrell chose to zero in on needles specifically with feces among other things. You talked about it's unacceptable to state of the cleanliness of streets,
Right.
period. Why start with needles? Is that kind of the lowest hanging fruit, or you feel like it's the biggest problem? Why needles?
This is step one and one of the most acute issues that we hear about all the time. But let me be clear, this is a part of the larger street cleaning program that we are going to unveil. Again, as I've talked about from day one as being mayor of the city of San Francisco, three things: homelessness, public safety, and street conditions have been the biggest things that I fought for as a supervisor, and that I'm going to be addressing and have been addressing as mayor. So later on this week, we're going to have a broader discussion about street cleaning, including feces, including urination, and all those issues. But needle pickup is such an acute issue that I want to make sure the residents of our city know that we are now having a dedicated team specifically focused on that. That we will be held accountable, but also that we can make sure that we ask residents of our city to engage with us on 311 so that we can respond effectively as well.
Can you speak to us about the homeless in San Francisco? What's the latest that the city is doing to kind of ease this issue right now?
Look, homelessness has been an issue in our city since I was born and raised here. It's obviously becoming a bit more of a crisis over the last number of years. Tenant encampments, a lot of other issues around it. What we're doing is working, but we need to do more of it in the city of San Francisco. So again, we're going to be talking more about homelessness as it relates to our budget and what I'm doing as mayor moving forward. Obviously, we are doing additional work right now in the Mission District, specifically around our tenant encampments. You know, back in 2016 when I authored Proposition Q, as I've said since then, and was at times on a political island talking about it, nobody is getting better by sleeping in tents at night. There's inordinate amounts of rape, drugs, crime, arson that happen in these tenant encampments. They are not healthy for the city of San Francisco. They're not healthy for the people that are living in them. And they're also, quite frankly, incredibly scary for people that live near them. So we're doing everything we can to resolve the tenant encampments on a very voluntary basis. But if not, we're going to begin implementing Prop Q in a more aggressive way, because we have gone in San Francisco from a point of compassion on our streets to enabling street behavior. And from my point of view as mayor, that is unacceptable.
Well, you will have to get tough, but that's a very good statement. A lot of the merchants want to see the city get tough.
Look, to me, it's not a matter of getting tough. You know, these individuals have a tough time living on our streets. Let's be clear about that. And we want to approach it from a compassionate point of view. But at the end of the day, you can offer services, you can offer housing and shelter to people ad nauseum. And at a certain point, as a city, we need to draw the line and say, you know what? Okay, this now is a service-resistant population. We need to take down those tenant encampments because they are unhealthy for the entire city of San Francisco, and that's what we're going to be doing.
There are 1,047 people on their sleep shelter bed wait list as of this morning. Do you have any plans to open up more shelters to help people who are living in the tents? Where are they supposed to go?
Look, a huge part of what we're doing as a city government right now. We're going to be opening up. We broke ground a few months ago as mayor of the city of San Francisco on a new navigation center. We're going to be opening it up, we hope, next month. So we are building more capacity all the time. That has to be part of the solution. Again, we want to offer every individual shelter and housing to be able to go in off the streets. We want to get individuals off the streets, on their own 2 feet, and onto better lives. Plain and simple. This is not as simply of moving around from one neighborhood to the next. So as we add capacity, we're absolutely doing that in our city budget, but proactively. Again, many of the people behind us are supporting those. Director Garcia has been a huge proponent of that as well. But in the meantime, we cannot, while we have capacity and we offer people shelter and housing, we cannot allow them to continue to reside on our street and tenant encampments. Incredibly unhealthy for the city of San Francisco.
Going back to needles specifically, in terms of using 311, people are, to an extent, using it for needles specifically, but a lot of people are complaining that when they get the response of, well, we'll try to get to this needle in 24 hours, or this stash of needles in 48 hours. That's frustrating. Do you expect this initiative to speed that up?
Exactly why we are doing what we are doing today and announcing this new team. We want to be, as a city government, responsive to our residents. And look, that might not have been the case in the past as much as we want to, but I will say as mayor, it is incredibly important to me that our city government responds quickly to our residents. We've done that with our Healthy Streets Operations Center called HSOC regarding homelessness. We want to do this here with 311 regarding needles specifically.
Any other questions? All right. Thank you.
Thanks, everyone.
Everybody.